Hi, welcome back. Today we are going to see an important topic of comparison between that is Dka and Hhs, that is diabetic ketoacidosis and hyperosmolar hyperglycemic state. We can see what are the main difference and how we can remember these points during our final preparation. So let's go. We can see the typical patients which are affected in Dka is type 1 diabetes type of patients, and in case of Hhs it is type 2 diabetes patient, and it happens even in elderly patients. And in case of onset it is rapid, it is very quick, it takes within hours to 1 day, and in case of Hhs it is very slow, it takes from days to weeks. And we can see the glucose trend in Dka, it is about 250 to 600 milligram per deciliter. In case of Hhs, it is very high, it is above 600 milligram per deciliter. In case of ketone bodies, it is present in Dka type of patients, it is absent in case of Hhs, or it is present very minimal. And in case of Dka, the metabolic acidosis is seen. We can see the pH that is less than 7.30, where in case of Hhs, there is no significant acidosis in the ABG. And whereas dehydration is moderate in case of Dka type of patients. In case of Hhs, it is a severe dehydration we can see. And the respiratory pattern mainly which are seen in Dka patient is cosmal respiration pattern. And in case of Hhs, it is a normal, or the patient might have a mild tachypnea. And the breath odor, how we can find out in Dka, it is a fruity odor which is called as a acidotic breath. And in case of Hhs, there is no changes in the breath odor. And in case of neuro symptoms, Dka, we can see the patient is alert and drowsy. It may vary from alert to drowsiness, where in case of Hhs, the patient is having confusion and he may even end up in coma, which is most common in Hhs. Where in case of mortality, the mortality by Dka is very low, but Hhs, the mortality is very high. So these are the main important points which we are going to see in these type of patients and how to differentiate the symptoms. And next coming is, we can see what are the important tricks. In case of Dka, we can see the ketones and the cosmols and the acidosis. These are present. In Hhs, it is extremely high sugar, severe dehydration and neuro changes. And what is the Nclex priority differences? Dka causes danger, causes acidosis and arrhythmias because of electrolyte imbalance, and Hhs danger is profound dehydration and the patient might end up in shock. So the Nclex trap here is, if the question shows type 1 fruity breath and deep rapid breathing, then we have to pick up